Hello everyone, my name is Melody Routley. I'm a Nursing Professional Development Specialist for the Kaiser Permanente Northwest Regional Hospitals, as well as the CNA2 educator. And this presentation covers the CNA scope of duties, as well as communication practices, both written and verbal. First, let's talk about what our CNAs can do. So what can you do as a CNA2 in our Kaiser Permanente hospitals? To figure this out, we start with the Oregon State Board of Nursing. The Oregon State Board of Nursing decides what tasks the CNA2s can do in the state of Oregon in our inpatient care settings. This comes from the variety of different training programs and what is safe for our patients regarding CNA2. Those lists can be found under the Standards and Authorized Duties in the Division 63 of our Nurse Practice Act. It reviews the CNA1 and CNA2 specifically for acute care and what duties can be done. And then from that list, Kaiser Sunnyside Medical Center determines what can be performed at Kaiser Sunnyside. So it's a lot smaller than the list from the Oregon State Board of Nursing. So what does Kaiser allow, and how does that differ from the Oregon State Board of Nursing? Well, you have two handouts. One handout is titled Nursing Assistance in Oregon, and this is from our Oregon State Board of Nursing, and it lists everything that the CNA2s can do, as well as the CNAs. And then the second piece of documentation, you have a handout titled, What Can Our CNAs Do? This is from our Kaiser Permanente and Kaiser Sunnyside Medical Center, so that you can gain an understanding of what is allowed for CNAs to do at Kaiser. What I'd like for you to do is compare and contrast the list at Kaiser compared to the list in the Oregon State Board of Nursing list. So in your handout titled Nursing Assistance in Oregon, you can look starting on page 11, and that lists all of the CNA1 duties for acute care, and then you can look at page 15, which starts the CNA2 duties for acute care. So look and review those lists and then compare them to the list from Kaiser, and then let's see what you find out. Go ahead and pause this video while you review those documents. What did you find out about the two lists? Did you notice that the Oregon State Board of Nursing list is a lot longer? And that there are some things on the Oregon State Board of Nursing list that isn't on the Kaiser list. So it's important to know that the lists that are on the Kaiser handout, what our CNAs can do, is what is allowed at Kaiser facilities. So even though it may be allowed at a state level, it's not allowed at a hospital level, and at the hospital level is where you want to pay attention to. So if it's listed in the Oregon State Board of Nursing, and it's not listed on Kaiser, then you can't do it. Does that make sense? All right, let's jump up and over to communication, specifically documentation standards. You are required to document any patient information that you collect, and you also are responsible to document any care that you perform. So if you're going in to do vital signs on a patient, it's important for you to enter those vital signs in to the medical record and not write them down on a sticky note and give them to the nurse to document. You're the one that collected that information, so you're the one that needs to enter it. It's recommended that you document as you go, which is as soon as possible. Don't wait till the end of your shift. Documenting as you go keeps the medical record updated and current so that all members of the care team have the most recent information so that they can make medical diagnoses and plans of care on that documentation. And speaking of that, many medical diagnoses and many plans are based on your specific documentation. There's a lot of planning around the vital sign results, I's and O's, and that's what CNAs document and CNAs enter in the medical record. So you must be accurate in your documentation. Let's look to verbal communication. Verbal communication is a little bit trickier than written communication. It's important for you to keep the nurse updated on your patient status, updated on the tasks that were not completed, and any abnormal findings. Abnormal findings are anything from vital signs, intake and output, mental status, behavior, all of those things. So let's take a closer look at some of the things that you might want to consider. What should you report to the nurse? I have a 69-year-old patient with a blood sugar of 136/78. I have a patient with a urine output of 250 mils over 3 hours. I have a 45-year-old patient with a pulse of 96 beats per minute, and I have a blood sugar result of 72 before a meal. I also have a 96-year-old patient who doesn't know where she is. Which of those situations would you report to the nurse? I think that out of all of those, I would report the 45-year-old patient with a pulse of 96 beats a minute. That's a little bit fast. But then when you scroll down to the next set of things, when should you report to the nurse? So I would report that my 60-year-old patient with a blood pressure of 136/78, I would report that blood pressure to the nurse if that is an outlier. If my patient has been running lower or higher than that, then I would report this abnormal finding to the nurse. I might report a urine output of 250 mils over the past 3 hours if that is a decrease or increase from what the patient's normally been doing. Or if my patient's on a diuretic that's making them go a lot, and this is not a lot for a patient who's on a diuretic. 45-year-old patient with a pulse of 96 beats per minute. I would report that definitely if the patient has been running lower or higher than that. And then 72 blood sugar results before a meal. I would report that if that hasn't been the norm for my patient, or if my patient is exhibiting other symptoms from a low blood sugar. Should I report a 96-year-old patient who doesn't know where she is? I would report that most definitely if the last time I was in that patient room, she knew where she was and she knew what day it was and she knew what she was doing. So if there was a mental status change, I would report that to the nurse. So it's not about what should you report or when should you report. It's bases on the situation that you see. And the importance lays on the outliers. So if you have a run of blood pressures and then you have this abnormally high or abnormally low blood pressure, you need to report that to the nurse. You must receive a report on your patients from the nurse at or near the start of your shift. Although it's okay to exchange information with the offgoing CNA, that does not replace the report from the nurse. So I need to ask you, why is getting a report from the primary nurse different than getting a report from an offgoing CNA? The primary nurse is the one that's going to have the most updated information on the patient. The nurse has the most recent orders from the physician. She has the most recent plan of care. He has the most correct and updated information for that particular patient. So it's important for the CNA that's going to be taking care of that patient with that nurse to talk to that nurse to get the most updated report about that patient. It's also important for the CNA to understand what the nurse is expecting that CNA to report to them. Use SBAR, that Situation Background Assessment and Recommendation, when communicating information about your patients to members of the care team. This is included written as well as verbal communication. So let's look at an example. This is an example of an SBAR report. The situation and background is I have a diabetic patient who's on QAC and QHS blood sugar monitoring, who happens to have a blood glucose of 48. Wow, that's pretty low. The recommendation is, do we need to give the patient something? Do you want me to give some orange juice? That is an example of an SBAR report that you could use with a nursing staff. So put this in SBAR. Let's say that you have a patient, Derek, who's a 22-year-old college student, and he is admitted in a respiratory isolation room. His vital signs are 132/56, heart rate of 130, respiratory rate of 20, and temp of 102 orally. He's on 3 liters and standing at 97%. And then when you helped him into the patient gown, you notice that he has a rash on his chest and he complained of neck pain. You also placed electrodes on for telemetry. So what would you report to the nurse? I would say that I have some abnormal vital signs. Did you notice his heart rate, his respiratory rate, and his temp are all a bit abnormal? So I would report those. I'd also report that the patient has a rash on his chest and that his neck, he has complaints of neck pain. That's what I would report to the nurse. Consider giving the nurse a summary report at the end of your shift. And also consider participating in nurse knowledge exchange on your more complex patients. Given a summary report at the end of your shift is important for the nurse to gain an understanding of what happened throughout that shift. CNAs are in their rooms a bit more often than the nurse and have a closer relationship sometimes to the patient and see a lot more things. So you have information that is crucial for the nurse to have in order to make that plan of care. So giving a summary report, even though it may not seem like it's important information, might really very well be vital information. Nurse knowledge exchange is the shift report that the two nurses do before the nurse leaves for the day. And why might you participate in a nurse knowledge exchange on those more complex patients? What could you potentially contribute? As a vital member of the patient care team, the CNA2s have very crucial information that they can pass on to the nurse. And then also listening to the exchange, you could develop a idea of what is needed for that particular patient during that particular shift. And that's verbal communication.